welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today I have the honor of interviewing Elizabeth King on the topic of hurdles of trying to conceive after a miscarriage. Elizabeth King is a certified fertility health coach, master certified ICF life coach, a birth and bereavement doula, and new parent educator. Her mission is to help people of all backgrounds conceive a healthy baby and carry to term. After having 3 children of her own after the age of 40, Elizabeth believes taking a more holistic approach is a linchpin to success when attempting to conceive. Now she has helped hundreds of women achieve their dreams of conception and parenthood in over 20 countries around the world. She supports clients through natural fertility, infertility, IVF, miscarriage loss, early pregnancy, PTSD, and new parent support. With over 20,000 followers on Instagram, Elizabeth is the host of podcast Pretty Little Tribe. For her expertise, she has been featured on ABC and Parade Magazine, Thrive Global, Authority Magazine, Business Innovators, and on podcasts, The Transition Channel, The Bachelor to the Burbs, and she's a contributor to the book Naturally Conceived. Hi, Elizabeth. Welcome to the show. I'm very excited to have you on today.
Thanks for having me. I'm happy to be here.
So I'd love for us to start with just talking a little bit about who you are, what you do, how you got into being, this passion.
Sure. So I am an international fertility coach. I help women and men figure out their path to their fertility. So as anyone who's been down the road knows that it's not always very straightforward. So I help them figure out how to get there faster to parenthood. So whether that's conceiving on their own, alternative methods, adoption, whatever it may be. And we look at the big picture. So I always say we start off where the doctors finish. So you walk out of that door and then we kind of have our powwow of what does that mean? Where do we go from here? Do you need help understanding that? And what's the next plan? So a lot of times just having the plan and knowing the direction you're going helps you with your peace of mind and, getting those cortisol, adrenal levels down and keeping everything in place where we want them to be in order to move forward with this process.
Wow, that makes so much sense. There's so many couples that want to be parents and the whole process can be very overwhelming if it hasn't, happened naturally. There's a lot of unknowns, especially if they do the testing and everything looks normal, right? If something shows up in the test, then at least you know how to take action around that. But if it's unexplained, right, then it's like, as you mentioned, it could be the male or the female or both that are contributing to this. So, how do you walk couples through this?
So, and I got into this from my own experience, really. I had been a certified ICF life coach since 2008. And when I started having my own kids or trying for my own kids at age 40, after my first loss is really when it set into, oh my gosh, there's such a void here of support. I was literally in the bed getting ready to do the D&C and the bed next to me separated by a sheet. They were doing their first egg retrieval. So they were like as happy as can be, like this hope happening for them. And here I was like shocked that this was happening. Right. And just at that moment realizing, okay, I'm going to shift my priority of my life coaching business to really focus on serving and supporting women that are going through this and men, as I mentioned before. And so how we go about it is really everybody comes to the situation, the table differently, right? So some people have had multiple losses. Some people can't even get pregnant. So it just depends on where they're at as for where we start and where we go and what they're open to as well. So it's very tailored to each individual, just because everyone operates differently. And I can tell somebody one thing and it's going to, go right over their head for some. And for others, they really need to have their hand held through the whole thing. And wherever you're at, I meet them because it is unlike anything that we're ever prepared for in our life. We've heard of people getting divorced. We've heard of people, buying houses, selling houses, whatever. But nobody really talks about the details of struggling with fertility and what that means, whether it's natural or if you're going through an artificial way of trying to conceive. I mean, people don't really go around the ins and outs on that. And so it's a whole learning curve in and of itself too, when you kind of start getting your toes wet in it. So we just help them get there.
That's true. And I think what I find is culturally, it's kind of like there's a lot of shame around that. And so therefore women aren't talking to friends or family and sharing. They're just keeping it all inside because they're embarrassed, I guess, that this isn't just happening so easily, maybe for everyone around them. And like everyone around them is pregnant and happy and glowing and they're in a very dark place.
Yeah, you feel like you're broken. What did I do wrong? What am I not doing right? I mean, you feel like if somebody were to tell you stand on your head and turn around 3 times, you would do it if that's what was going to get you there. And so it can be very discouraging because a lot of people that I see are very type A. So they feel like they are checking off every single box that they possibly can, and it's still not working. And so we really look through, okay, how do we show up differently in all aspects of your life to make that happen? And sometimes it's, they're holding on too tight to one thing, and letting go of that sometimes is what, makes it happen. So again,
that's beautiful. And that's really good advice.
Yeah, it just depends on where you're at. And sometimes you're in it so much, you can't really see clearly because you're in it, right? So it takes an outsider's perspective to really say like, hey, this is what I see that you need to let go of a little bit.
I love that. Yeah, and that's where coaching comes in, right? Is getting that objective, unemotional, perspective.
Yeah. And a lot of people don't realize too, and fertility coaching is still quite new, although there's so many people out there that are doing it, which I love to see. But they don't really kind of understand the difference maybe between seeing a therapist that specializes in fertility versus a coach. I often say it's similar to like seeing a personal trainer, right? You want to gain 10 pounds or lose 10 pounds. You have this person that you're accountable to all the time, and you talk to them more on a friendly basis versus somebody as a therapist. They don't always, sometimes they do, they don't always share their experience with you. And part of coaching and why I got into that was so that people can really feel heard and seen by us having an open dialogue, and knowing that, the client I just talked to before you, she's having one of those days that we've all had when somebody looks at you wrong and you're just crying, right? Well, that doesn't wait till Tuesday at 10 a.m. for when your therapist appointment is, right? So we have that open dialogue, that if they need that support during those times, they have it. Because again, fertility is, you can see a pregnancy announcement that triggers you, or your sister-in-law says something to you or whatever. And so it's really delicate, I guess is the only way to put it.
It's very delicate, very sensitive. And like you said, everyone has coming from a different place. So I want to hear a little more about your personal story. You mentioned you got pregnant and then you had to do a D&C.
Yes. So I did IVF on my own at age 36, with the intention of, hopefully someday I'll meet a husband, but maybe not. And so let me just do this as an insurance policy, like check off the box for the 401k and the egg freezing, because that's what I thought was the right thing to do at the time. And then at 40, I met my husband. I had just had a fibroid surgery 3 months before that. So essentially, as soon as I had healed from that, the doctor had said, okay, now really start trying now that we've kind of removed this obstacle. And I got pregnant on that first try. So I had this kind of false sense of like, oh my God, all my worries are, it's all fixed and everything was good and the fibroids were the issue and, let's move on. And mind you, I was 41 when I delivered my first baby. So I got pregnant that time and that was a live birth and everything was great. And that's subsequently I had secondary infertility, just meaning that it wasn't happening after that first one. And there was nothing that pointed to other than my age. So again, at that point I was 42. So that was a big thing, of course, that the doctor kept saying, well, given your age, most likely this isn't going to happen. You probably got lucky with number one. And I just had this knowing in my body that like, I wasn't buying into that. for better or worse, I just didn't think that that was the reason for me. I did get pregnant a second time, and that's when I had my first miscarriage. And that really felt like, again, I wasn't aware at the time the statistics around how frequent losses happen. And having had a live birth before, I took for granted, like, okay, you get pregnant and you watch the baby because I was seeing an RE, a reproductive endocrinologist. I was seeing him every week for the first 12 weeks. So when I had that first loss, it was nothing really major. 9:00 at night, I had like a nickel size amount of red blood. And I called my doctor that night and he said, well, it could be a number of things, but if you want to come in the morning to check, we can check it out. And sure enough, there was no heartbeat. And I was just shocked. Of course, they're not shocked because they see it all the time. But when it's you and you're there and there's nothing like it. I mean, like the story you write as soon as you get that positive pregnancy test in your head of like what your life's going to be like, that's when it starts. When you know, okay, there's 2 lines, or the pregnant, not pregnant, and seeing the progression, and people will tell you, oh, if you see a heartbeat, then you're less likely to have a loss or whatever. Well, my losses all were at that point, beyond that point, and so nothing really after that felt like it was secure for me. And so I realized that I needed to channel that and help others going through it, because the PTSD around having those losses and going into another pregnancy and feeling like, how am I supposed to stay happy and excited and positive for this pregnancy when I've been through this before? I know what the reality is of, the chances of it not working out. And so that I spend a lot of time with clients right now around that, because there's a very fine line between the reality of what it is and not downplaying that, because I always say we're realistic. We're not going to pretend like, oh, it's all rainbows and butterflies. No. But we really manage through the anxiety levels of going through a pregnancy after a loss and figuring out what works for each person and each couple, because oftentimes the spouse or the partner in that relationship is also very nervous, not necessarily for themselves, but for whoever it is they're alongside. And I hear that all the time, is like, this time, I was a strong one and my spouse was the one that was crying there, and so then you feel like, how do I comfort them and also, figure out, okay, what are my next steps? How do I get through this? And also what I try to put towards people so often, though, is you really need to also grieve that loss and acknowledge it, because we do write that story, and to feel like you're just checking the box and moving on to the next thing in order to try again is great, but you're not acknowledging something that could potentially come up years from now. And I do have a lot of clients that have had miscarriages and or late losses, 7-10 years ago, that are still grieving it until we go through a real process to heal that. So it's really important.
It really is. And I think, a first trimester loss is still a loss, right? And it does deserve, it's worthy of grief and the whole grieving process that goes with that. So it makes sense that would be part of your program.
Yeah. And to your point earlier, the embarrassment, the shame, the guilt, all these weird feelings that come up around it, you don't expect it. And yet when they arrive, you're like, what is this? I know on a logical level, it's not your fault, but then you're like, okay, like my client told me the other day, should I not have eaten that hamburger? Should I not? I mean, it becomes to the simplest things that you're wondering and questioning everything that you've done.
And blaming yourself.
Yeah. And it's hard not to, and so it's having somebody there to really coach and work through that with you, so that you can, yes, you're going to have those moments. Everybody does. But those are also the reasons that keep women as a culture silent about it, right? Because they feel like they don't want to talk about being embarrassed and feeling guilty and I'm broken. But really, if we're all talking about this, then everybody knows, oh, I'm not that way. She was that way too. And I always say, like, if you look down your neighborhood, 1 in 4 that we know of, right, has gone through it. That's a lot. Or if you're in
That's a lot.
or whatever. And if everybody was having this normal conversation, like it was, I hate to say, but for cancer or heart attacks or something else, you wouldn't have such a heaviness around you on top of having that loss too. And it's something that I just trying to normalize that conversation so that women know that you don't have to feel that way anymore, you know?
Yeah, I really feel very strongly about that as well. And, you know, even the current culture of not announcing pregnancy until after 12 weeks, right? Because of this fear of miscarriage. Well, what's sad to me about that, and obviously you're not going to announce it to everyone, but even not even announcing it to friends and family is because if you do miscarry, then you don't have to announce the loss, right? But then you don't get the support that you're worthy of helping you grieve that loss.
Yeah. And being excited, you know, like it is something to be excited about, to see that positive stick, right? Like it's hard to keep that in. It's not natural to keep that in, especially if you've been waiting so long to see it, you know? And so I agree. I always say, like, pick your solid people around you that you know are going to support you, because no matter what happens, you're going to want their support. And it is going to be so helpful for your, you know, moving on and your healing to not feel so isolated around this situation. So yes, announce it at least to the people that are close to you, as you said.
Yeah, not everyone needs to know, but, you know, I think in general, couples, it's just the two of them, right? And they have to keep this big secret for so many weeks before they let the cat out of the bag. And it just seems like intense.
It is intense, and it's sad, really, to think, because it should be something that's celebrated from the day one with everybody. So I agree with you.
Yeah. So you had a baby, and then you had your first miscarriage, and it sounds like possibly more than one before you were able to go on to have another child.
Yeah, so I had baby, miscarriage, baby, miscarriage, baby. So I have three children in the end. So I had between 41 and 44, I ended up having 3 live births.
That's amazing, by the way. And that really speaks to your lifestyle.
Yeah, again, I'm the first one to say it's not ideal to have them at that age. But again, I met my husband at 40. So it wasn't like I was just sitting around necessarily waiting for the right time. However, there's so much that we can do now to get our bodies and our eggs healthy as much as we possibly can, and more information now than we ever had before in order to help that along. And so I really do believe that having that healthy lifestyle and the mindset is, you know, huge. There's statistics and studies that say you're up to 55% more likely to conceive if you are doing some sort of cognitive behavioral work around that, that's leading you to that direction. And part of that with age, I think, is just really not buying into what society tells us. I mean,
yes.
Clients like are in random places around the world, in Jamaica and Africa, that are like, there's people in my village that are having babies, you know, in their 50s and 60s, which is, you know, mind blowing to me. But it just shows you that I guess it is possible. It's just here, especially in the United States, we are so conditioned to think anything over 35 is geriatric.
That's right.
Which, again, I understand there's certain risks that go with being older as a parent. But, you know, if it's something that you really would like to do and that's your goal, I think it is possible. You just need to find the right way to getting there. So, yeah, going forward with continuing to try at my age with the losses was another kind of interesting dynamic, I will say, as far as people around you thinking, okay, why would you even bother trying? You're 42 years old now. You know, of course you're going to have these losses. And I think that's part of it, is just realizing, again, statistically, I'm a very black and white person. I know the risks of, you know, my eggs are not 25 years old. So I know there is a potential that this is going to happen. but I also knew that I did have my first, at 41. So I knew there was something potentially good in there, right? I knew that it was possible. And then after my second live birth, same thing. But I had gone to doctors that had said, well, you should just go the egg donor route. And I remember thinking,
well, you froze your eggs.
So yes, that takes me back to, I didn't actually go to the frozen eggs until after baby number 2. Because everyone up until that point had pretty much said, if we are going to go down IVF, down that route again, it's better for us to just do a fresh retrieval and, kind of start new, because it's just, let's try that instead of doing the 36-year-old eggs. We did thaw the 36-year-old eggs again before baby number 3. And unfortunately, none of those were able to be a successful fertilization. So none of them made it to day 3. I had 11 eggs, and let's see, 3 of them fertilized out of the 11, and those 3 didn't make it. So I tell people that too, just so that they're aware that even the egg freezing at 36 is not a guarantee. Do
you have any regrets of doing that?
I definitely don't have regrets for doing it. What I wish I would have done, and I got lucky in my situation, of course, but what I often tell to people now is, depending on where you're at with your relationship and or potential, and how badly you want to be a mom regardless, because I have a lot of clients that are single mom by choice, or they would say not by choice but they're doing it on their own.
Right.
Is that having those 36-year-old eggs fertilized at 36. So you freeze some eggs and you freeze some embryos. Right. So that if you do decide to do it on your own at 42, I just had one who's 48 in Israel who just had her baby, that you're still working with 36-year-old eggs, right? Because the consistency of the egg versus the embryo thawing and all of that process is much different, and your chances still are, the technology is better, but you're
right. I was going to say the technology is just really grown.
Yeah. And it's amazing. And so I would never say to someone not to do it, for sure. I would just like them to get more educated on it, because everyone thinks that, I freeze my eggs and
that's enough.
Yeah. And there's a lot of steps that go into that in order to still be able to conceive from those eggs.
Right. And then the other thing is, you don't want to fertilize all of them, because if you do meet a partner, then he probably would want his sperm involved, right?
Exactly. So at least you would have kind of a little bit of choice.
Got it. So for the third baby, you did fresh retrieval and IVF?
We ended up doing IUI with the third baby. The doctor that I had seen up until that point, and I had some complications with my miscarriages. I guess I should back up to say that too. It's with the last one before baby number 3, I had some fetal tissue that was left over. And so I just had continuously large amounts of blood. None of the medication was working. I think I was on 4 rounds of it and nothing was working. And
this was post DNC?
Yeah.
Wow.
Yeah. And my doctor just kept saying, like, no, it's fine. Did an ultrasound. No, it's fine. And I just knew something wasn't fine. So I went to a second opinion, and they saw some leftover tissue, which was what was causing the bleeding there. Even though my HCG levels had gone down, that's really the only thing that was just still causing bleeding there.
You had to get another DNC?
So I didn't do it. I had such an issue from the last one. They basically said, you can wait it out still. And I think we were maybe 4 months past. So I gave myself 1 more month to see if it changed or not. And it did. So I just didn't want to put my body through another DNC if I didn't have to. But at least I had the knowing of, like, I wasn't crazy, that something actually was causing this severe bleeding for so long.
Does that mean the DNC was incomplete? It didn't get everything?
Yeah. Mm-hmm. And with the DNC, at least at the clinic that I was at and clinics that I work with, it's not a scope necessarily where they're seeing what they're taking. So that is a risk that can happen.
So then once it passed, then you were able to do the IUI.
So with seeing this new doctor that gave me a second opinion, I had asked him, would he do IUIs? Because my previous doctor would not. His opinion was the chances of that, I can put the sperm up there, but it may not meet the egg. It's not worth your time and money for me to do that. I kind of felt like, well, I feel like I can get pregnant. I just don't have time on my hands. Again, I was now at this point 43. And a funny story, I actually thought I was 42 at the time. So I didn't realize that until I was about to deliver my last baby. And my husband's like, you're not 42, you're 43. And not only was I not 42, I was almost 44. So I was really off on my age for some reason. But
young at heart.
Yeah, I guess so. I don't know. Ignorance is bliss. So
as a mom of a toddler, I know how frustrating it can be when the sun is shining in my child's eyes. We're driving down the road and there's nothing I can do to protect him. I'm just praying that I'm going to be driving by some tree coverage so to help, shield that sun from his eyes. And that's why I was so excited to find this product from Baby Trend called Cover Me 4-in-1 Convertible Car Seat. This car seat is amazing. It comes with a innovative and patent-pending integrative canopy that offers height adjustability, ratcheting coverage, and side sun protection to literally create an umbrella and shield that sun from my son's eyes, which is amazing. It's also so cool that this car seat can literally be used from newborn all the way through 100 pounds, which is phenomenal. It just makes the life easier for parents and child. To check it out, go to babytrend.com/OSSA, OSSA, and use the code COVERME20 for 20% off.
This doctor that I got this second opinion from said that he would try that. And so we did it, and we got very lucky on the first IUI that we got pregnant during that.
And it's less invasive than IVF.
Yeah, it is. So most people don't realize that you still have to take some medication, but not to the extent that you would if you were doing a full egg retrieval and transfer and all of that. So yeah.
Right.
Yes.
Wow. So I know the lifestyle is a big part of why your body was able to do this in your 40s. But I also am very much hearing the mindset component, that you really were kind of like protecting yourself from the naysayers. You have to block that out, right? When people are judging and saying, well, I don't even know why you're doing this. It's nobody's business, right? So, what's your advice to women that are maybe having family members, especially if they want to be a single mom and they're not feeling the confidence perhaps to be able to do this?
Yeah. Especially with the next generation, I see it was my situation as well as a lot with my clients, or it's like my parents, my mom, my aunts, it's that group generation that didn't have this at all as a conversation to have, or like, what are you even doing? Just relax and you'll get pregnant, go on vacation and you'll get pregnant. And unfortunately, that's not the case for many people. So it's really realizing your boundaries. And yes, the bottom line is it is none of their business, but unfortunately, we can't really just say that to most people. So it's figuring out where you are comfortable with your boundaries, and again, having that knowing within you. If you have that knowing that you're going to be a parent, whether that's through adoption or naturally conceiving or whatever it is for you, that often kind of helps you get through your times when people are doubting you. And or maybe not even so much doubting you, but just being a little bit more negative than you would like around the situation. And only you can determine whether you feel somebody that you're with is open to this conversation, right? And if you realize that they're not, then you know what? Pretend like it's not happening around them. If that's what's easier to
change the subject, right?
Exactly. It's all about self-preservation. And you want people around you in this situation, especially, that are going to be lifting you up and supporting you from a genuine perspective, rather than putting any doubt into your realm at all. And then as far as the women and men that are going through it on their own, I love so much. And they're the first ones to say, like, they feel like they have more support around the situation than we do as far as somebody who's coupled, because they say everybody who knows me knows that I'm a single mom. So they're like watching my daughter or my son all the time. Everybody offers to take them. Everybody, is always willing to give that support and that love. And family, you build what you want your family to look like. That can be, your neighbor down the street can be Uncle Jay versus, sometimes the families we come with are not even that supportive and great anyway, right? And so it's about really opening your mind and your heart to the ability that you have this choice to love and bring this child into an experience that you get to choose. And it takes a little bit of getting used to and comfortable with the idea of that. But I always say, find somebody who has gone through it, whether that's donor conception or doing it on their own, and you will see that you will see no difference if you see somebody on the playground that, they're a donor conception parent or a single parent, because they love that baby so much. And it's all about just building the family that feels good to you. And you don't want to have regrets later in life, I always say too. So if you really have this knowing that being a mom is what you want to do, regardless of somebody else in your life, it's possible now, again, with our technology, which is so amazing. And there's so many women out there now. There's a huge community of men and women that are doing it on their own. And it doesn't take long to find that space, to find that community and people to support you with it. So I'm all for it. It's not easy. I don't think it's easy. It's not easy being a parent with a partner. So, but again, some of them will say it's easier because they don't have to run anything by them. They make all the decisions on their own. And, so it can definitely be argued both ways.
Yeah. I mean, I even learned recently from a woman in her 40s, single, just really, really wants to become a mom. And she was sharing with me that you can adopt embryos. So if there's couples who have extra embryos and they will no longer need them, you can adopt them. Especially, if you're like, I think she's 41 and she's like, well, that might work better than my own eggs. Right. And there's also, I guess, less likelihood of, relatives, right? If it's just a sperm donor.
Yes, exactly. Exactly. No, there's so many amazing options now. It really, truly is incredible and so cool that all these things are out there. And more often than not, with the embryo adoption, people will have, I had a woman this morning, she has 11 embryos. She's not going to have 11 children. So this happens all the time, especially with women that have PCOS, which is a lot of women out there that end up getting a lot of healthy embryos. So if it's something that anyone is potentially interested in, I would do a little bit of research on it because it is a really great option.
Wow. And I want to also just focus a little bit about the topic at hand, which hurdles of trying to conceive after miscarriage. So you've been pregnant twice after miscarriage. Share with us what you did and what you teach other women as well.
Yeah, I don't wish it on anybody. It's not easy, and for several reasons. The physical, of course, everybody reacts different after having a miscarriage. So whether you've done a D&C or you've taken the pill or it's happened naturally at home, everybody's body is going to react differently. So having the awareness of your body to say, okay, do I need a second opinion on something, or are we good? Is everything kind of back? Is my cycles back? Do things feel on track? I always tell people to advocate for themselves. Go back to your doctor, get all your blood work redone, see where your hormone levels are at. Go on, day 2 of your cycle, make sure that you're tracking it on the correct day, and see not only from your emotional, physical, spiritual standpoint, but literally where is your body telling you that you're at? Because when you've had a loss, of course, you're Googling, like, how soon can I get pregnant? And you see stories of like, oh, I got pregnant right away. And you have hope that could be you, but in most cases it's not you. And you mentioned the recurring loss panels where most of the time people don't get an answer as to why this is happening. And so that is like a whole nother aspect of, when we have an uncle pass away or somebody we love pass away, there's most of the time always an answer as to what happened, and we can understand, and that helps us through our grieving process to move forward because we can make sense of it in our brain. Usually with a loss, unless you've done a DNC where you can get the tissue tested to see what exactly the issue is. And even sometimes the tissue comes back normal and there was no reason, right? And so it's really difficult sometimes to be able to make sense of a situation that doesn't make sense. And that's where a coach can help you do that. And even if that's just, one session of figuring that out from a grieving and a loss and a emotional aspect in order to put that in a special place for you so that you feel like you have dealt with it and you can move forward. Because sometimes that blocks you from moving forward with your next pregnancy and you're not even aware of it. And then there's for some people, the PTSD or the anxiety that will come along when you go into the next pregnancy. So that really is, everybody gets to a different stage of knowing when they feel comfortable. Some people it's 8 weeks because in their head, they think, okay, if I've seen the 8-week heart rate, I'm good, or a heartbeat. Some people it's 12 once they've passed the first trimester. Some people, it's much further than that. And allow yourself the space and the grace to be good with whatever you feel good with, right? If people around you are like, oh no, you're fine now, and you just don't feel that you're fine yet, just keep working with somebody to support you through that, because it is a real thing, that stress and anxiety and concern that you don't feel like you should feel when you're pregnant. And again, working with a coach will help you to find those moments of joy, even though you have some fear. And the fear is normal. It's from what you've experienced. It would be impossible for somebody to say, oh, don't worry about it. Of course you're going to worry about it. You've been on that table where they're looking for a heartbeat and there's no heartbeat. Like it's very real for you. And so having certain tools to help you through that. So help you through your fear, anxiety, and PTSD, as well as having the tools to help you to find joy and connecting with your partner and connecting with your baby, even though you feel that way, are so important, because that goes back to, the stress levels crossing the placenta and all of that. We want it to be happy, joyful experiences that your baby's feeling, rather than fear and being scared around it. So it can be complex depending on where you're at and what your experience has been, but it's very doable. And, I work with people every day around this exact issue, and everybody is different depending on what their experience is, but it is possible to still be excited and fearful at the same time, because again, we're not going to pretend like there's not, especially when you're, outside the door of your ultrasound or whatever it may be. It's very real. And so we work through a lot of those, tools in order to help people get through that fear.
So Elizabeth, you're helping women like with their subconscious beliefs.
Subconscious and conscious, for that matter. Right. Yeah. Mm-hmm.
Because I know, I like to refer to hypnotherapy if a woman does have PTSD, whether it's a loss or, let's say, a traumatic birth.
Yeah.
Because that does very much get ingrained in our subconscious mind. And to your point, with a future birth, future pregnancy, we have to be realistic, but what we're talking about is not necessarily realistic. Like that overwhelming anxiety and fear is not necessary.
Correct.
Right?
Yeah. And so it's similar to work that you would do with a hypnotherapist, as well as, are there limiting beliefs that you may subconsciously have? You don't even know that you're aware of this. And maybe that came from somebody you saw on Instagram or Facebook that had a traumatic experience or birth or whatever, and you've taken that on. And part of what I work with my clients is really limiting their social media exposure during this time, because you're not even aware that you're taking it in, but you can't undo what you just read, right? So from reading it and seeing it visually, it goes pretty deep into our subconscious mind. And so to undo that and realize that's not my story, that's Susie Q's story. And, yes, that can happen, but that doesn't necessarily mean that that's what's going to be happening to you. And so really trying to get that to a perspective that they can buy into. So it's different than an affirmation of like, this won't happen to me or whatever it is for you, because that's not going to resonate to you on a cellular level. We need something that people really in every part of their body can buy into, so that they really start to shift their brain to say, instead of firing this direction, we're going to start firing that direction.
Totally. It's like, what type of tools do you work with to help with that?
So it depends on what resonates with each person. So sometimes we do something called Psych K, which is...
I do Psych K in my office.
Oh, awesome. Okay. And I feel like that helps the most as far as, letting go of those limiting beliefs that people have around. Sometimes we do like a deep meditation that is very similar to hypnosis, but yet they're still aware and conscious of what it is that we're going through. And sometimes it really is just cognitive talk therapy through it. It just depends on the level of what they need. Sometimes I refer them out to EMDR if it's, taking something that really physically did happen that was very traumatic. Maybe they had a loss where they saw it happen at home, and they physically saw the situation, and that's really traumatic for people to go through, and multiple sessions of that. So I always say too, we put together a fertility team of who's going to support you. So whether that's acupuncture, a therapist who's doing EMDR or something like that. So it just depends on what each individual's needs are.
Mm-hmm. And I would advocate for chiropractic as well. I'm a chiropractor, just to help the nervous system, right? The parasympathetic, sympathetic nervous system be more in balance.
100% for not only them, but their babies and everything. I mean, I'm a big believer in all of that. So
yeah,
100%.
And it's a team support. So I know we focused a lot on like first trimester miscarriage, but I'm even thinking, what about later loss? I mean, that might be even more challenging. You're showing, it's more visible. Probably a lot more people know about the pregnancy, and now the baby is gone.
Yeah. In fact, I get body chills every time I think of it. So I'm also a bereavement doula specifically for this situation. I have helped a few, I wouldn't say many, but there's more than I would like that have had late losses and or stillbirths. And there's, again, specific things that we would go through in order to help women go through, like heal their heart through that is really what it is. And it's crazy enough, a lot of times they don't even have an answer as to what happened there, which seems insane to get your head around. Like my baby was moving inside of me 2 days ago or yesterday, and now it's not, and they can't give you an answer. So there's a lot of anger that comes along with that. So that is definitely a different process to go through. It doesn't mean that you can't have a baby kind of the same amount of time that somebody had an early loss. Some people do. But oftentimes what does take the time as far as waiting on that is really doing enough research to say, we know it's not genetic, right? We know that something else isn't going to come up with the next loss. And I really encourage meeting with specific REs around that's focused on genetic disorders if you have had something that late, because the last thing you want to do is, go down the road again and have the same thing happen. And with technology and IVF, you can literally eradicate those things from your family line now, which is incredible. I have a handful again of clients that have had Huntington's disease or cystic fibrosis or a very rare one called GM1, that they now actually have healthy babies because they went through IVF to get embryos that don't have those DNA strands. So the late losses, I highly, highly recommend working with a bereavement doula or somebody that can help support you through that, because you do not want that pain and heartache to be lingering on longer than it has. It will always be with you, and I never pretend like it won't. But again, doing certain things to acknowledge that loss, that pregnancy, that experience, talking to somebody about the joys of what your pregnancy was like, as well as, a lot of times they just want to share that story of what happened, whatever it may be. Part of that is just the healing. Really working around the support of your community is huge. It's okay to go inward and shut down for a little bit, but that's not healthy to stay that way for very long. So we kind of put together a time frame of what feels good for you, and that shifts. So maybe you're at your 2-week point and you still don't feel like you want to see anybody. That's okay. And then we work through the next aspect. We work through with the family as well, because it affects everybody. And we're, of course, the most concerned around the mother during that time. But yeah, the late losses and stillbirths are not so easy to deal with.
As a bereavement doula, are you at a stillbirth, like present physically?
It depends on, sometimes they don't know that it's happening, right? So yeah, but if you do know it's happening, then yes, for sure, you're there. You set up time with the hospital, the nurses around, because the nurses are not trained on how to deal with this either. So sometimes you feel like she wasn't kind to me. But that's because it's not her thing. She's not meant to be doing that. We set up, if there's someone from a spiritual aspect, whether it's a priest, a chaplain, or a rabbi, or somebody you want to have there, I help them set that up ahead of time. We make sure that there's space privately just for the family to grieve for as long as they need to. We have things set up specifically for, does the parent want to have time with the child before? Do they not? Like, depending on what the situation is. So there's a lot that goes into it. Again, that's knowing ahead of time that it's happening. I would love for people to know that this is even a thing if they have, their sister or their in-laws or somebody who's going through this, so they can say, hey, maybe you should reach out to a bereavement doula.
It sounds like it would be so healthy. What about siblings? Are siblings even allowed in the hospital to meet their deceased sibling?
So it's up to the family if they want that to happen. Usually the siblings are too young to really get their head around the concept of what's happening. And most of the time the parents choose not to have that, but there are times when they do, and they have a right to do that. They can also do, the handprints, footprints of the baby, things like that can sometimes help the little ones at home, because they are part of the process, with seeing mommy's belly grow and feeling the baby throughout this time and all of those things. And then all of a sudden the baby doesn't come home. So it really is something that we work through with everybody so that they can help communicate that to their little ones, and they can try to understand in the age appropriate way of what has happened.
Wow, this is like so intense for me. I'm shocked.
I know. I still have goosebumps talking about it, because it's, and the sad thing is it's happening more than we know,
Yeah, it certainly does. I mean, and even, infant loss, right? My cousin recently lost her 3-month-old baby, and it's just it's just unbelievable.
Unbelievable. There's no words to like somebody's worst fear, I don't know. Mm-hmm.
And I think, because I'm a mom, I can't even imagine having to go through that.
Yeah.
So my heart really goes out to families that have experienced this.
Yeah. And I think just also the word out to the families and hospitals and practitioners to help support the families that are going through it, and know that this is a thing, that people are there to help them through this process, because it didn't used to be that way, where, it was like the hospital maybe sent somebody there who, again, they're not connected to, they don't want to see. Another big thing to watch out for with that is domestic violence, because they don't know how to handle the anger that comes around with it. And so they will often say to people, make sure that everything is safe around, because, it's something that you never expect to happen, and people don't know how they're going to deal with their grief. So, yeah.
Oh, wow.
It's definitely interesting.
Yeah. Well, Elizabeth, we have to wrap up, but I'm so grateful for you to take the time to come on and share. And this has been really eye-opening.
Yeah, thank you for having me. And thank you for doing what you do, because again, it's all part of building the strength up for the body to get to where we want to be for a healthy baby, right? Not only a healthy pregnancy, but the idea is all the way through.
That's right.
Yeah.
Wonderful. Thank you.
It was nice to meet you.
I hope you enjoyed this episode with Elizabeth. I think for me, what I got out of this, it was just how there's so much support and information out there. And as women, all we have to do is ask for help, which can sometimes be hard. But, including if there's a need for a bereavement doula, that these types of services do exist. And, when we're going through really challenging emotional times, that is the best time to reach out and get support from those that have experience and expertise in these areas. And also to understand that there's a lot of holistic healing modalities out there. Elizabeth and I both practice Psych K, which is about addressing subconscious beliefs and removing any subconscious beliefs that are no longer serving us. And this is available from practitioners all over. So if you're feeling stuck, and especially going through, cycles of PTSD where you're repeating the same thoughts or images, working with a healer that provides these types of tools can be very powerful.